Is your dog's constant sneezing just a quirky habit, or a silent scream for help? The truth might surprise you, and ignoring it could have serious consequences. Every dog owner has seen it. That adorable, often comical sneeze. We usually brush it off, thinking it's just a bit of dust or excitement. And often you'd be right. But what if those sneezes are happening nonstop? What if they're paired with other worrying signs that you're completely missing? Today we're cutting through the confusion, exploring exactly what's normal when it comes to dog sneezes, what's definitely not, and most importantly, when you absolutely need to drop everything and head straight to your vet. You might just save your best friend's life. First things first, let's talk about what's usually okay. Just like us, dogs sneeze for simple, harmless reasons. They might have sniffed up a bit of dust, a stray hair, or even a tiny piece of grass. Sometimes excitement can trigger a sneeze. You know, when they're so thrilled to see you, their whole body wiggles, and a little achoo pops out. These are typically isolated events, maybe a quick series of 2 or 3, and then they go back to being their normal, happy selves with no other symptoms. Then there's the reverse sneeze. This one often scares owners, but it's usually nothing to worry about. Instead of pushing air out, a reverse sneeze pulls air in rapidly, making a snorting, gagging, or wheezing sound. It sounds like they can't breathe and can last for 10 or 20 seconds. This happens when something irritates the soft palate or throat, like quick eating, excitement, or even allergies. Most of the time, your dog will just clear whatever caused it and be perfectly fine. You can often help them by gently rubbing their throat or briefly covering their nostrils to encourage them to swallow. If it happens rarely and your dog is otherwise healthy, it's generally harmless. But if it's constant, very severe, or paired with other symptoms, it's worth a vet check. Now let's get down to the serious stuff. While a single sneeze or an occasional reverse sneeze is usually no big deal, there are specific signs that tell you something far more serious is going on inside your dog's nose or respiratory system. This is where most owners make the mistake, thinking all sneezes are the same. They're not. The biggest red flag is nonstop, persistent sneezing. We're talking about frequent, repeated bouts throughout the day after day. If it's been going on for more than 24 to 48 hours, that's a concern. Another critical indicator is nasal discharge. If the discharge is clear and watery, like a human cold, it could be allergies or a mild irritation. But if that clear discharge quickly changes to yellow, green, or thick mucus, that's a sign of infection, either bacterial or fungal, and needs a vet's attention. Even more alarming is bloody discharge, even just a few spots, which can signal foreign objects, trauma, severe infections, or even tumors. Beyond the sneeze itself, pay close attention to other accompanying symptoms. Is your dog pawing at their face or nose? Are they rubbing their face on the carpet or furniture? Do they seem to be in pain when you touch their nose area? Is one side of their face or nose looking swollen or different? Is their breathing labored or noisy? Are they suddenly tired, losing their appetite, or running a fever? Do they have bad breath, which can sometimes indicate a hidden dental issue affecting the sinuses? Any of these signs, paired with persistent sneezing, are flashing lights screaming for immediate veterinary attention. So what exactly could be lurking behind these worrying symptoms? The list is surprisingly long, and each one requires specific treatment. Imagine a blade of grass, a tiny stick, or a foxtail getting lodged deep inside your dog's nasal passage. It's incredibly irritating and painful. The sneezing will often be sudden, violent, and often accompanied by pawing at the nose and possibly bleeding from one nostril. This is a common occurrence, especially for dogs who love to sniff around in tall grass or dirt. These objects won't just sneeze out and can cause severe infection if left untreated. These microscopic creepy crawlies, called Pneumonisoides caninum, can live inside your dog's nasal passages. They're highly contagious between dogs and cause intense itching, head shaking, reverse sneezing, and sometimes nosebleeds. They're often overlooked but can make a dog's life miserable. Dogs can pick up fungal spores from the environment, especially from soil. Fungal infections like Aspergillosis or Cryptococcosis can be very serious. They often lead to chronic nasal discharge that can be bloody or pus-filled, facial pain, swelling, and sometimes even erosion of the nasal bone. These infections require aggressive, Long-term treatment. While less common, especially in younger dogs, older dogs can develop tumors or polyps in their nasal passages. These usually cause chronic, progressive sneezing, often with bloody or mucopurulent discharge. You might also notice a change in the shape of their face or nose as the growth expands. Believe it or not, a severe tooth infection in the upper jaw, especially from the canine or premolar teeth, can actually erode through the bone and create an opening into the nasal cavity. This is called an oronasal fistula and can lead to chronic sneezing and nasal discharge as food and bacteria pass from the mouth into the nose. While mild allergies usually cause clear discharge, severe, chronic allergies can sometimes lead to inflammation that makes the nasal passages more prone to secondary bacterial infections, resulting in thicker, colored discharge and persistent sneezing. Just like people, dogs can get upper respiratory infections caused by bacteria or viruses. Conditions like kennel cough, canine distemper, or canine influenza can cause sneezing, coughing, clear or colored nasal discharge, and sometimes fever and lethargy. Listen, I know it's easy to think, oh, it's just a sneeze, especially when our dogs are otherwise happy. But here's the critical takeaway. If your dog is sneezing, if there's colored discharge, yellow, green, or especially blood, if they're pawing at their face, acting tired, not eating, or if their face looks even a little bit swollen or different, these aren't just minor irritations. They can be signs of serious, progressive conditions that need immediate veterinary attention. Don't gamble with their health. It's always better to overreact and find out it's nothing than to underreact and regret it later. So, next time your dog sneezes, take a moment. Is it just one or two? Or is it a flurry of nonstop bursts, maybe with some other worrying signs? Remember the key differences we talked about today. A simple dust sneeze is fine, but constant, accompanied sneezes are a flashing red light. Stay vigilant, trust your gut, and when in doubt, call your vet. They're there to help you keep your beloved companion healthy and happy. Want to keep your furry friend safe and sound? Click here to watch our next video on common dog health myths you need to stop believing.